Are you struggling to advance your career and sacrificing time with your loved ones because of endless to-dos, low energy, and just not enough time in the day? If so, then this podcast is for you. I am your host, Dr. Tsung, an ER, critical care, and space doctor, a peak performance coach, real estate investor, and a mother of a toddler. I'm here to guide you on mastering your mind and give you the essential skills to achieve peak performance. So welcome to Productivity MD, where you can learn to master your time and achieve the 5 freedoms in life. Hello, welcome to Productivity MD podcast, and I am your show host, Dr. Tsung. And today I have Dr. Bradey Block. He's a general ENT surgeon, and also he is partner at ENT Allergy Associates in Long Island. And also he has created the podcast called Physician's Guide to Doctoring. And it's a personal professional development podcast for physicians. It has over 400 episodes, 500,000 downloads. And the reason why I have Dr. Block here actually is because this is specifically for physicians, but non-physicians can probably take away from this too. How do you see a lot of patients quickly in your day, but at the same time, have them love you and feel like they are heard and understood? So again, Dr. Block, thank you again for coming onto the show. Can you give us a little bit of reason why you created a podcast like that and how you got down to maybe distilling down the science of like how to see so many people be productive and be able to have them be seen, feel like they've been heard as well? Thank you.
So first, thanks so much for having me on the show. I've really been looking forward to this, and I've been a big fan of yours for a while, so it's really an honor to be here. So I mean, my podcast, The Physician's Guide to Doctoring, I created because, so I've been at it for over 6 years now, right? Which makes me pretty old in podcast years. I created the podcast that I needed, that I wanted, because I was a big fan of podcasts to begin with, right? And I heard all of these shows that help people with communication, right? But they were directed towards sales. They're directed towards dating, right? Executives, leadership, public speaking. But I really didn't find anything that was directed specifically towards the nuances of the doctor-patient relationship. So I was like, you know what I'll do? I'll take all this information that's out there and I'll write a book. And I never did, never lifted a laptop, nothing. So I was like, okay, I'm not going to do that. That's not working. How about, what if I write a blog? Again, never opened my laptop to type a, okay, fine. I'll just have my own podcast where I can ask those same people the questions that I have. And so that was the birth of the podcast. Because I saw my partners were able to see many more patients an hour or a day than me and leave on time. What were they doing differently? What was their communication style that I didn't have? Right? In residency, I was always really slow at seeing patients. So what did I need to bring to the table? And what can I learn from communications experts that I could bring to help me move faster without sacrificing patient care, or maybe even enhancing patient care? So that was the birth of the podcast. The problem was I couldn't get these experts in front of me without having an established show. I didn't know any communication experts, but I did know experts. And as physicians, we all know experts. They were our classmates, right? Our classmates are all now that, we're all attendings, at least at that point I was, all my friends are experts in whatever their field is. And I've got friends from college and high school. All these people did really well, are very accomplished. They're experts in their own right. And so what I started doing is just, kind of a general physician interest. This is stuff physicians should know. And so we did episodes on things that people get wrong about the Affordable Care Act, or high return on investment advocacy, right? You want to advocate for your patients or for your profession. Like, how do you do that without investing a ton of time? So those were the first couple of episodes. So then it just exploded from there. But I always came back to my first drive for doing it, which was communication, improving my own communication with my patients.
Got it. Yeah. And I know a lot of people are spending time charting after seeing patients. They want to be able to sit down, not chart in front of the patients, and they're spending time so they can be present. And then they're spending time afterwards charting and into the night. So it's so important to learn how to be productive, be able to communicate, but at the same time, get your charts done and not
Yes.
sacrifice your family time for work because you're not getting paid for those charting time.
Yes. Yeah. I mean, you are, right? It's part of the package. Just like when I do a surgery, the op note and the post-op care, the global period, like all of that is billed for at the same time in one lump. So you are actually getting paid for it, but it doesn't need to be as inefficient as it is for some people. And so I've interviewed a couple of people who are their charting coaches. They help people get home sooner. And so I've learned some things from them that I've incorporated into my own practice. For instance, right, you mentioned the charting. Let's talk about charting. One thing that people do is they assume just because there are people in the waiting room and they've maybe been waiting for a while, that you should save your charts for later so that they don't wait anymore. The problem with that thinking is that if you do it while those patients are presumably breathing down your neck, you're going to be able to finish that note lickety split. But if you save it for the end of the day, it's going to be like a gas where it expands the space into the space that it's given. And so if with no urgency, it's going to take you much longer to write that note. And so it behooves you to finish that note right after you finish seeing the patient. One, it's fresh in your mind, so you don't forget about things that you might not include in the note, which is not good for patient care, but also not good for billing, right? You might end up billing a less complex visit because you haven't included some things. So it's good for the patient, it's good for the visit, and it's good for the next patient if you mentally close that browser window. So finish that note. And there are some tools that you can use to make sure that you finish that note. First of all, that tool is your own brain. Just like recognizing that these are the ways of thinking that got you in trouble in the first place, where you had like 20 notes to finish at the end of the day, right? So stop thinking that way. Take care of yourself. Fill your own cup first, right? Put on your oxygen mask before you put on the patient's oxygen mask, and take care of that note. That's one thing. Another tool is that I use is dictation. I have dictation software, so I can dictate the note in front of the patient. And the third thing that I've been using recently is actually an AI scribe. So the AI scribe, I don't use it for every visit every time, but it's always there in case I need it. So sometimes what'll happen is I will talk to the patient for, a couple of minutes, and then I'll stand up, start examining the patient. I can keep talking to them while I'm examining them, and the AI scribe continues to listen and build that note for you. So even though you're not sitting and typing it as the patient's talking, it's still getting like recorded and a note is getting created. And so that allows you to move a little faster, but at the same time, you're still listening to the patient's whole story. So, there are some things in there that you can use that's just scratching the surface of like all the things that I've learned to help me navigate even just the communication. We haven't even gotten into the communication part of it.
Yeah, I think what you mentioned about like saving yourself first in a way, it's doing that note right then. It's in flow science, neuroscience, flow science is a cognitive load dump. So you don't have that attention residue from the last patient. So you can actually be present and focus on the next patient. So it's not just like, you're trying to rush to the next patient, but then you're distracted by all the notes that you have to do. So that's doing them a disservice in a way. And so work with your biology, work with your brain, dump out that cognitive load you had from the last patient into the note, be done with it, make your plan so that later on they're not all jumbled together. And what AI scribe pro? I know there are so many. I wonder which one have you tested and which one did you go with? Again, we're not endorsing any company here, but yes.
So, in medical lectures, we always have to give disclosures. So I do have to give disclosure. They did sponsor my podcast. So I use Freed, FREED.ai, but that's the only one I tried. So I tried it and I've been using it ever since. It happened on a day where like 2 of my computers were down and my dictation software wasn't working. So I was like, oh man, okay, I'm in trouble. I've got all these crutches and now they're all gone. All right. And so that's when I started using it, and I've been using it ever since. And it took me a little while to figure out just how it fit into my specific flow, right? Just because it's recording doesn't mean I have to use that note. Sometimes it's faster for me to just dictate a quick, 3 lines for the history if it's a really simple problem, than to have to copy and paste that note and go through it. Like, it doesn't always work every time. And so, but for the patients that have like a litany of complaints, It's complicated. They're going through a lot of different stuff. It's helpful to have that. So you can also focus on them and not on your note taking, right? You can just look the patient in the eye and be present, which is part of the, now we can get into the communication aspect of it, which is, being present. So when I was in med school, I'm not sure if they told you the same thing, but they said, listen, make sure you're listening. Patients want you to listen. Listen, listen, listen. Yeah. You know what? I can type and listen at the same time. Right? I can take the notes. I can even fill out some of the physical exam while I'm listening. I can, but I'm not present, right? There's a difference. So it's important to be present. So you look the patient in the eye and you really listen to their story by being present and undistracted. And that means you need to, like, you talk about productivity in the flow state a lot. Well, being present with the patient, you've got to make sure you set things up to be able to do that. So one, minimize distractions so that you're not looking at the news. You're not checking your email. I mean, the one part about the AI scribes is your phone ends up doing the recording. So you have the app open on your phone and on your desktop or laptop so that it, goes from one to the other. So that means I have my phone with me, which is a distraction, which is a problem for me, right? So I end up screwing around a little bit when I shouldn't because the temptation is there. So you got to take away as many distractions as you can and make sure your staff as well knows that, only disturb me if it's really, really, can't wait for later so that you can really be present with them. Because the minute you have distraction, right, it takes you away from the moment, pulls you out of the story, and then you kind of you have to mentally reorient. It's like multitasking is a farce, right? Multitasking is a farce. Yes, you can listen to a podcast and do the dishes because of the minimal cognitive load required of the dishes, but that's not what patient care is. And so, as few distractions as possible. The thing is, you can't fake that. You can't fake being present. So the patients pick up on that. They're less likely to repeat themselves, right? Patients sometimes perseverate. They'll say the same things over and over. They're less likely to do that if you're really with them and present as they're telling their story. And so, yeah, actually, that's the second step. The first step is the introduction. Sorry if I'm taking off with this and going ahead. So the introduction is you enter that room with enthusiasm, right? You set the tone, right? They may be not feeling well, but you are so glad they came to see you. That's the type of enthusiasm that they want. Whether you're glad or not, right, is beside the point. But you're going to enter with the energy that you are glad they came to see you today. And you thank them. Like, we take this from hospitality. Welcome to the Hilton. Thank you so much for staying with us. Thank you so much for coming to see me today. They could have chosen a number of emergency departments, a number of practitioners, or they could have chosen to stay home, right? But they chose to see you. Thank you so much. Okay, so that little shift in the previous power balance is going to help soften them a little bit to the visit and make them more welcoming to new ideas, making them more receptive to healthcare information, right? Because you come up, your cortisol is firing when you're sick, you're at the doctor, you're worried that something really dangerous or scary is going on. So anything that you can do to make it a more welcoming place is going to lower their cortisol level and make the whole visit go a bit more smoothly. So you enter with enthusiasm, you thank them for coming, and you ask them, what would you like me to call you? And then, that also addresses if maybe they have a pronoun that was incorrectly put in the EMR, maybe they like to be called a certain thing. Maybe they have a nickname that's not in the chart, right? Maybe they want to be called formally. Call me Mrs. So-and-so, right? So what would you like me to call you?
That's good. That's good. Step one, even though sometimes I'm thinking about like in the ER, that was like, they would be like, I have no choice. They just took me here from the EMS. So, and that's,
no, but hey,
I wonder.
Listen, I am so glad that you're such a good advocate for your own health that you called EMS. Thank you for being such a good advocate for your own health, right? There's an opportunity there, right? And it takes a second and a lot of the things I say are going to take time, right? But they're investments in the longer visit and relationship development.
Yes. And I can think of maybe when psych patients like suicidal ideation came in like a few weeks ago, walked up to the fire station herself, realized, had the insight that she was suicidal from hearing these voices. Next time that happens, that would be a good opportunity for me to thank her for having that insight, to be able to go to the fire department and to come here. So
right? What does that tell her? What does that tell her? That her doctor is thanking her for coming in? Like, oh, now you're giving me the ability to take care of you. And if you hadn't done that, I wouldn't have that ability. So thank you for giving me the opportunity to help you. Right? Like it shifts the power balance and it makes the visit just go a lot smoother.
That's I'm going to start using that. That is a great tip. I think I learned it one time in residency from my attending. And then after that, I kind of just like stopped doing it, especially like in the ICU being in fellowship, you just get your patients up, like it just gets shipped up from the ER, gets shipped up from like, upgraded from regular medicine floor or wherever. And you just don't do that anymore. It's just like report. You just get the report from other people. And it's almost like the patient's the third person in the room.
Yeah.
So,
right.
Acknowledge them, thank them, ask them for how they would like to be called, and then being present, listen, so they feel like you're actually focused and paying attention to them. Now, usually, well, how many steps do we have?
So you know what? I total, how many steps do we have total? The thing is, I give this talk in a bunch of, I have like a lot of different tips, and we'll see what we have time for. Because, we go through the introduction, we can go through some sticking points, we can go through ways of earning trust, right? So there's a lot of different angles to this, and not every visit requires all of them. And you might not remember all of them, right? Every single time. You've got enough to worry about. You're trying to actually take care of the patient, not just, you're taking care of the patient's medical issues, but you're also taking care of like their psychosocial issues as well, and trust building. So yeah.
What about
I don't have like a formal stepwise, like this is the order that you do things or these are the number of things. Maybe I should though. Maybe I should log it in a more formal way.
Like non-negotiable must do top 3 to make the most difference in the interactions. In your experience, was there something that every time you said it, 90% of the time you did it, that it was like, I must do this next time. Is there something like that?
So one thing is,
we talked about,
like maybe not a non-negotiable, but like you'll notice that some visits get hung up on an issue where you're like, oh, I figured out their problem. Great. Now they can go home. But they're like resistant. You haven't delivered it in such a way that they're satisfied with this answer. You're like, I figured out your problem. Great. Here's this medicine. Now you can go home. And you're stuck. So
abdominal pain, but no etiology in the ER, pan scan, labs normal, but they still have pain. I think that's a common one in the ER.
Yes. Okay. So one thing that you can ask would be, what worries you about this? What worries you about this problem? Listen, I don't have the answer to make this problem go away, right? We scanned you. We know that it's not a tumor. We know that it's nothing life-threatening. But that doesn't seem like it's satisfying. Like you still seem uneasy about this situation. What worries you about this? Because maybe there's something that they haven't said. And so what that gives them, because patients are afraid of being judged, right? The doctor's going to think I'm crazy. The doctor's going to think this about me. I'm not going to say that because then this gives them permission to relax a bit and divulge that bit of information that they may have been keeping from you. What worries you about this? And so then for a lot of our patients, they come in to see an ENT with globus, which is a sense of something stuck in your throat. And a lot of them come in because it's just an annoying sensation and they'd like to make it go away. But some of them, it's not that annoying. They just want to make sure they don't have cancer. And they may not verbalize that. But you, by saying, what worries you about this? They're like, doc, I just, my uncle died of throat cancer. I just want to make sure I don't have throat cancer. So, we'll do an endoscopy on them in the office and we'll have made sure that there's nothing there. But unless I specifically say those words, I don't see any cancer. You let me take a really good look down there. I didn't see any cancer. That's not something you need to worry about now. That needs to be verbalized. And so it doesn't apply to every visit, but where it does, it's absolutely non-negotiable. That phrase is going to get you places.
I agree. That's good. That's good. I have used it very few times because it's, we're always in a rush in the ER.
Yeah.
And it's almost like you want to sit down, be willing to listen to what they give you. You don't want to ask that question because you don't know how long it's going to take. I'm going to use it though. I'm going to use it next time.
But it's the investment. Like you got to recognize that some of these are investments to those patients that otherwise are going to end up taking up a lot more of your time because you haven't let them say that. Another one, similar one would be like, listen, you've had abdominal pain before and haven't gone to the emergency department, right? Everyone gets stomach aches from time to time. What was different about this one that says, you know what? It's time to go to the ER. It's something similar question, but another way to get that information to help them bridge that gap between the information that they have that they haven't divulged yet about their problem.
Mm-hmm. Yeah, you know what,
And it
you're
may
right.
prevent further visits. It may prevent them from going, listen, actually, here's a different way to think about it so that the next time it happens, use this information to help you determine whether it's the appropriate thing to go to the emergency department or not.
Yeah, I think a lot of times in terms of like asking what's different about this, or well, you had this for like a whole month or a whole year, like why now? That sometimes like makes them divulge like that information that, what they were truly worried about, like you said, because the qualities change, whatever, or the family. Anything else that you think is, well, either if there are must do's or non-negotiable, or we can talk about top mistakes to not do.
So another one that'll help is the patients want you to see them for more than just the sum of their symptoms, right? How do we talk about patients, right? The diabetic in room 3 or the facial fracture in room 12, right? Like we talk about them as their pathology, right? And it's shorthand. We do it to lift the cognitive load, right? We see tons of patients every day that are inordinately complicated with gobs of information in each of them. And we need to lift the cognitive loads off our own brain. So we do that as a shorthand to make it easy. And yes, it's a little depersonalizing, but because it serves a purpose, right? For our own well-being, so we can continue to help them, right? Well, Mrs. Francis in room 12, well, which one is she, right? So, but in order to help us not see them that way and help them recognize that we don't see them that way, is you identify something on their person that you can ask them about. Those are really cool earrings. Where did you get them? You're an Alabama fan because they're wearing an Alabama sweater, right? Or their hat or their keychain. You notice something on their person, or like, they said like, oh man, this all started after I got back from my trip. Oh, where did you go? The worry I get that they're just going to open up it's going to open up a Pandora's box and they're going to tell you all these information. But most people pick up on social cues. And when, they've divulged a little bit of information, that's enough. But they want to be seen as more than the sum of their symptoms. And so ask them something personal about themselves that is like readily attainable information that helps you connect to them. So those little things are really going to go a long way towards that trust building. Because, it's interesting. There are some patients that you see, and I know you do it in the emergency room, where you can come up with the diagnosis in like 10 seconds of walking in. You walk in, you know exactly what's going on with that patient, right? And you know how to help them. You know what labs order, you know what you're going to get, you know what imaging study you're going to get. If anything, you know how to help them, right? So what's the point of this conversation? What's the point of talking to the patient if you know exactly what to do? Trust building. A lot of the communication that we do with patients is not just information collection, it's trust building. And so once you recognize that that is part of the point of communicating, it's going to help you navigate the process a little bit better. It's not just information collection, it's trust building.
Yeah. And you want to build that trust so that when you give an advice or when you are speaking with patients regarding like various options, that you guys are not coming like, butting heads against each other and causing a terrible experience, causing like people to leave against medical advice, etc.
Yeah.
So because they don't trust you, sometimes that just happens. And I do want to take note that, everything you said, whoever's listening to this, even though you're not medical, this still applies to whoever you're interacting with. Maybe you have clients, maybe you have like, in the work environment, people your team, etc. They want to be heard as well. They want to be seen. They want to feel your presence, and you want to ask them something about their personal, like, their whatever's on them, right? So don't just take this and say, oh, it's only for physicians. Okay. Anyway, anything else or any top mistakes?
So top mistakes. Okay. Jokes aren't a mistake. jokes are important. Telling jokes can, like we talked about at the beginning, that cortisol level is elevated. You're in the emergency department. You're at the doctor's office. You're worried that something's wrong. You're uncomfortable because of your symptoms, right? It's going to make it hard to understand complex health information. It's going to make it hard to be open to new ideas. So maybe your diagnosis that you give them isn't what they thought it was, and they're going to have to be open to new ideas. So one way to make them, more receptive to new complex information or new ideas is to lower that cortisol level. Make them laugh. But there are rules to this. Like, how do you make people laugh appropriately in a healthcare setting? And there's a fundamental rule here, and that is the goal of humor is to comfort the afflicted and afflict the comfortable. Comfort the afflicted and afflict the comfortable. Our patients are, by definition, the afflicted. So the patient can never be the butt of your joke, right? Mm-hmm. Never punch down, never make fun of the patient, okay? You can make fun of yourself. Self-deprecation humor is fine and acceptable and a good one. Just never make a joke that's going to erode their confidence in your abilities. So you want to make a joke about the handwriting. You want to make a joke about your typing abilities. Don't make a joke about your surgical skills or like you fumbled the pencil or something like that, right? So there are some things, and you can save a bad joke. You can save, hey, listen, it's a good thing that I am an ER doctor because my comedy tour would not have worked out, right? Like if you you can try. Listen, the patients come in with such a low expectation of their doctor's sense of humor that it only takes a little bit, like the classic dad jokes, right? These like corny, not so funny jokes, right? You just need to get like just something, right? But make sure it's appropriate. The mistake would be inappropriate jokes. So inappropriate jokes would be punching down, right? Inappropriate jokes would be anything like shock humor would be inappropriate, right? Like you just use profanity or something like that in a completely inappropriate setting. Race, religion, politics, you want to stay away from that stuff, right? You really want the benign stuff, right? Like you're sitting there typing on the computer, say something like, I'm sorry, this is going to take a little while. We still use dial-up, right? You see that fax machine over there. I think someone's on the line. They're using the modem. This is going to be a little while, right? You can make silly, stupid jokes, right? It's not that funny, but the bar is so low and it'll help to break the ice and help them relax. So the mistake would be one of those inappropriate jokes or punching down. Not okay.
I'm guessing you've heard of all these incidents of what not to do. That's why you're bringing it up.
Well, no,
it's surprising.
You see it online, right? You see a lot of these influencers who like make fun of patients, the things that they say and the things that they do for clout and for likes. And it's not okay. Take, for instance, the crown prince of comedy and medicine, Will Flannery, Dr. Glockenflecken, right? You will never see him punching down. He is always punching up. He's at the insurance companies, at the healthcare systems. Like he's hilarious, but he's always punching up. But you do see a lot of people punching down online, and it is just not okay. It's easy. It's easy. It's easy to make jokes when you're punching down, when you're making fun of those who are vulnerable, right? Not okay.
Yeah, I agree. And anything else then in terms like, I haven't really been making any jokes now that I think about it. I need to look at make some jokes, even though the ER setting, my cortisol's up, it's probably going to help my cortisol. Because my cortisol is elevated the entire shift, probably all 10 hours. So it'll probably help me if I laugh a little bit at my own jokes.
It helps you enjoy it a little more. It does. It helps you enjoy it a little more. And you'll end up using the same jokes because you see the same stuff, right? Like as much as the emergency department, people think it's like this huge variety of stuff, right? And there is a huge variety. But a lot of the stuff that you see is the same stuff over and over and over, which is why you're able to make diagnoses really fast, right? Because you've seen it so many times. You walk in the room, you're like, I know what that is. And so you end up making the same jokes up. And you'll see what gets a laugh. And you'll see what doesn't. And you'll end up being able to, hone your shtick like a comedian on the road. Because, the jokes that you made and when you did stand up in Milwaukee are not the same it's the same different audience in Cleveland. You have a different audience every, 5 minutes. So.
Yeah, maybe put a little play into your work, So perhaps I know so many people in ER, they're all burned out. Nobody has time for jokes. Nobody can like think of a joke every time a patient comes. And when it's a busy time, it's just like, "Ooh, okay, next. Can't get a breather, So I'll try this out and I'll see how
Just
it goes."
little things like, I'm gonna need that pen back. That's my favorite pen. And it's like some like disgusting, like, that you got from like the Hyatt, like, 5 years ago and there's barely an ink left or something like that, or another one is Dr. Google.
Mm.
Someone looks stuff up, Dr. Google. Oh, I went to med school with Dr. Google. Yeah, I don't think he graduated. He tells everyone, I think he's got a clinic somewhere where he just tells everyone that they have cancer.
Oh my God, that's so good. I'm laughing. I'm going to
And I
use
think
that.
he sells supplements. He tells everyone he has cancer and he sells supplements online, I think. So, that's because when people come in, they've looked stuff up. It's like, for me, listen, it's fine that they look stuff up. I just always tell them, listen, when you end up looking stuff up, when it's your symptoms, you're trying to be the doctor. And sometimes you can get it right and sometimes not. But when you come here and we give you a diagnosis, Google the heck out of that. Google that, right? Because then you'll come up with a lot of great information and much less misinformation. But like, so I don't want the listeners to think like I'm not okay with patients looking stuff up. I am, but it's still okay to joke about it, right? You're not making fun of their Googling abilities. You're just making fun of the fact that anytime you Google a symptom, it tells you have cancer.
True. Anything else that is a mistake not to make, like definitely not to make that, I don't know if you have like, let's talk about like, we talked one, maybe like two more.
So another mistake would be lack of eye contact. We're so concerned with documentation that sometimes we do it to the detriment of that connection. And it's not that you have to be making eye contact the whole time, because as you said at the beginning, it's important that we finish our notes so that we're not up all night away from our families and our other goals and our hobbies, right? And our self-care, but you still need to make eye contact. And so in order to avoid the mistake of not making enough eye contact, I recommend that you notice the patient's eye color. So if you notice the patient's eye color, you've definitely made eye contact, right? And you haven't had to like stare longingly into their eyes, right? This loving stare where you're staring the whole time, right? It's just that if you've done that, you've definitely made eye contact. Now, certainly you should make more eye contact from that. But if you're someone who tends to stare at their computer a lot because you're documenting appropriately, just make sure that you look up long enough while you're talking, that you at least notice their eye color. So that's a mistake, is that lack of eye contact.
Yeah, I think for me, one tactic, the listeners can try it, but I just take like quick notes on pen and paper, like literally when I'm in the room,
Really?
pen and paper, real quick. And then I see like 2-3 patients, usually maximum two patients in the ER. I go back and dictate on the dragon based on my notes. And I pretty much remember, both. And then I go back to see the next two. That's what I usually do. So just
would you be able to take a laptop into the room with you so that you can dictate in front of the patient? That work in the emergency department? Because it doesn't always, right? Because you guys are like seeing people in the hallway and, I know where I used to take call, like the hallway became an emergency room in and of itself because they just ran out of space.
Yeah, it's just like clunky to lug around. I can move faster, talk to them. It's not that long of a notes, and I can speak. I have all these smart phrases in Dragon that I can do a note in like 2 minutes after. So in residency, I did do that. I had a little laptop with me, like actually iPad with a keyboard, and that got me so fast. Like see patient's order, see patient's order, see patient ordered. I got really fast. So depends on the system. Of course, if you can wheel something right outside the patient's room or something, you come out. I've seen people, come out, do the note real quick, put in the orders, and just move on. That's another way too.
Because I find dictating in front of the patient sometimes helps them, because when they speak to us, they often speak to us in terms of the urgency of their symptoms, not in chronological order. And so they have this like completely disjointed story that starts in the middle and then goes to the end and then goes to the beginning and then back to the middle, right? And so if they hear you dictate it in chronological order, they're like, oh my God, I've never thought of my own story like that, right? And things can start to coalesce in their own minds a little differently. and they know you were listening. Like it's another cue that you were present with them and listening the whole time, right? Because there might have been distractions in there, but that them hearing you dictate their own symptoms. And then if you make a mistake, they'll be like, no, actually it started Wednesday, not Thursday. Like, oh, okay. It's maybe like that. It doesn't, don't say it doesn't matter, but like, it might not be of significance, but there might also be something of significance that you make a mistake with, and then they're able to correct you because, you misremembered something. But I mean, yes, you're taking notes, so you wouldn't misremember, but yeah, it does help them to hear their story again.
Yeah, to make them feel like they have been heard. That's a like basically repeating back what you heard, repeating the question back, repeating like, I heard you. This is what you said. It sounds like da 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 da. Same concept. Yeah. That's awesome. And what about the third thing? And is there a third thing that's like never do? Definitely don't just not look at them. We said that don't make like jokes.
Don't make inappropriate jokes.
Inappropriate jokes.
Don't just listen for symptoms. So when you're listening to the patient, don't just listen for symptoms. If you do, you'll get the diagnosis right, the same as you always have. You'll be able to take care of the patient the same way you always have, but you're going to miss something. So you're not just listening for content, you're listening for emotion. So you listen for emotion, you're able to then validate that emotion, right? Patient comes to me with vertigo. For all the listeners, vertigo is not a diagnosis, it's a symptom. It's the sensation that the room is spinning around you. So if you've never experienced it, imagine you're on a tilt-a-whirl, but you're not on a tilt-a-whirl. You're just like standing there and suddenly everything starts spinning around you, right? It's terrifying. It's awful. A lot of people just start vomiting, right? So if a patient comes to me and they're like telling me about their vertigo and I'm like, it's interesting. Yeah, okay. And then what happened, right? As opposed to, that sounds awful, right? I mean, as I'm saying it now, it kind of sounds performative, right? And a little forced, but that's because there's not a person telling me symptoms in front of me. So the other mistake would be just listening for content without listening for emotion. So you listen for the emotion too, and you reflect it back to them and you validate that emotion. Again, these things take a second to say. It just takes an extra second. And I know I've told you a bunch of stuff, and all of them together are going to take you like a whole minute between all of them. But one, you're not going to remember every one of them, every visit. I don't. And I lecture on this stuff, right? So you're not going to remember it every visit, every time. And not all of it applies every time. But remembering these few things and kind of peppering them into your visits are going to make it, one, more fulfilling for you because you're going to connect more with the patients. Human connection is super important. And it really brings some of the joy back into our professional lives when we're not just thinking of them as the sum of their symptoms. We're really connecting with them as people. So it makes it a more enjoyable experience for the doctor. And a lot of times it'll save you time on the visit because they're more likely to be like, this doctor is really cool. They get me. They understand me. I'm totally going to listen to take their advice on this, right? I'm not going to resist their advice. I'm not going to push back. I'm not going to question. I'm not going to move the goalpost, which is a lot of times what patients do is you'll like address all of their concerns and then they'll just keep moving and keep moving and keep moving the goalpost and, adding more stuff on top of it. And so, all that stuff is less likely to happen. You're going to be more satisfied. They're going to be more satisfied. And in the end, it'll cumulatively save you time.
Yeah. So it sounds like, as the summary, number one, thank them for coming. Number two, you ask them how they like to be called. And also throughout their visit, and make eye contact with them, validate their emotions, like not just listening for their symptoms and validate their emotions. Do some appropriate jokes with them, notice something that's on them on their person and make a comment about that. In general, just view them as human beings and connect with them as human beings, like your family, like your friends, and not just another patient who's coming through that you have to get through.
And I've had people push back on this advice because they're like, you should be treating every patient like they're a family member. And the reality of the situation is you see so many patients all the time that unless you have systems like these in place, it's really easy to go through your day and it turn into like a mill where you're just seeing patient after patient, you're just trying to check them off your list. So yes, it does kind of sound like you're forcing some of this stuff. But it's not that you're forcing it. It's just that you're remembering to do it. You're sprinkling this stuff in to help with connection. Because if you don't have these systems in place, these ideas in place of how you can navigate these visits, then you're not going to do those things. And you're missing out on a lot of opportunities. I just want to add one more thing. I know we've talked about a lot today, but it's one of my favorite things to do. And that is, I'll give you an example. So I see a lot of kids for tongue tie. Like I'll see like a 5-day-old for tongue tie, right? They come in, the parents aren't getting any sleep. They've got this fresh newborn at home. It was impossible to like make it to their appointment on time. Often they don't, but we'll still see them, right? Because just getting out of the house with like a newborn is really hard, right? You know that. And they make it to the visit. And, whether or not there's a tongue tie present is kind of besides the point of what I'm about to say. But like, that's a feat in and of itself. And so just like putting your hand on their shoulder and be like, you guys are doing great. You're doing great. Your kid's doing great. You're doing all the right stuff. Like, thanks so much for coming. Like, no, this is not a tongue tie. It's, blah, 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 whatever. We don't need to do anything, or it is, and let's cut it. But, it's a good thing you guys came in. You're doing a great job. You're doing it. Like, they feel like they're doing such a crap job. They don't know what they're doing. And patients often feel like that about a litany of things. And so anything that you can do to help their self-efficacy, like kind of build them up as a person, they're here to see you as a doctor because they're here about something that's important to them, something that they're unsure about, and something that you're an authority in. So the juxtaposition of those three things, something important, something they're not sure about, and something you're the authority in, makes you very influential. And if you take that opportunity to help build that person's self-efficacy, whatever they're in there for, like we said earlier, like congratulating them on being an advocate for their own health. But if there are any other opportunities, like someone struggling with managing their diabetes, someone struggling with their medication, someone struggling with something, and you just tell them, listen, you're doing great. Like they're bringing their sick kid in. I don't even know if I should have brought him in. I don't know if it's the right thing to do. No, mom, you're doing great. You did the right thing. You are doing a great job looking after your kid, right? How good is it going to feel to say that to someone? And how good is it going to make them feel to hear that, right? So you're going to have these opportunities in your life, not necessarily just in the exam room, to improve someone's self-efficacy, their self-worth. Take those opportunities when you can. The minute you start looking for those opportunities, you're going to see more of them. It's an awesome feeling for the person saying it and an awesome person for the person hearing it. So Find those opportunities and take them.
Yeah, that's very important. I agree because I've been on the receiving end of it. Actually, I took my kids, to the pediatrician, and like I'm a physician. I was like, I don't know if I should go up. I don't want to treat my own kid. And then my pediatrician was like, no, you did the right thing. You did great. You're doing a great job, mom. I'm like, oh,
right.
I feel better.
Yeah. Because it's like you're a mess. You're like, when's the last time I showered? Like, I don't know, maybe I forgot to bring diapers. So now the kid's like, soaked in pee, like, and you just feel like you're the worst. You don't know what you're doing. So to hear like, actually, no, you're doing great. You're doing great. Take those opportunities and spread the love. We need more of that in the world.
Yes. I'm going to notice more of those. I have not been taking those opportunities, I think, as much as I can in the ER. I'm going to notice more of that. And for those of you guys, if you guys are teachers listening to this, if I've been on the receiving end as a parent with my toddler child, I went to one school where the teacher didn't say anything to us. And then we changed schools, and the teacher, after like a few days, like, you guys are doing such a wonderful job with your son. I'm like, oh, thank you. So teachers, it also counts.
Yes. Yeah. Anyone who's in a position of authority, use it. Use it.
Thank you. And I think I will give you one last question, because I know you have, 3 kids of your own. Your family also manages, your wife manages a short-term rental as well, invested in real estate. So it's not like you don't have a very full family life as well. So how do you, in Productivity MD, we're always talking about being productive, not just in work, but in your family, your own life, your own self-care, your kids, being present and productive with them. So how are you able to manage it and be able to set your family as non-negotiables or self-care as non-negotiables?
A couple of things. One is, so right now I have three boys, 5, 7, and 8. And they're not going to be this age forever. And so if I do have like career goals or productivity goals or fitness goals, I recognize that when they are a little older and more self-sufficient, I will have more time. And so right now, in terms of physical fitness, I just work out on the weekends. I do. I just work out on the weekends. I don't work out during the week. I should, right? I should wake up a little earlier, but I can either snuggle with them on the couch because they wake me up in the morning, right? My wife gets them in the middle of the night. We're still not sleeping through the night. I'm sorry to say. So we still get some wake ups from time to time. So she gets them in the middle of the night. I get them in the morning, which gives her a little extra time to sleep. And so I could either work out, which I did for a little while. And actually when they were even younger, when they would sleep later, right? But now it's this different age. And then, I will eventually get back to it more. I heard Tom Hanks talking about this. He was like, I was in such better shape in my 60s than I was in my 30s because I was just in it with the kids and now I'm not. So now I'm in better shape. And so, working out is important to me. Listen, I used to be you should see my gym. I have like a CrossFit style gym in my house with like Olympic weightlifting. I put together a platform to be able to do like powerlifting and Olympic lifts. And I mean business when I'm working out. In fact, this weekend in the snow, I have a harness and I put them on the sled and I pulled them around the backyard in the snow. So, you can integrate the workout. So one is, you recognize that it's a fluid balance. It's not a static balance. And so I take the opportunities when I can, but I also recognize that they're not going to be this age forever. And it's also when I'm with them, I try my best to be present. And one thing that helps me to be present and make the most of this time, and it's going to sound a little dark, is something called negative visualization. So negative visualization comes from the field of positive psychology because it helps you appreciate what you have. So I will visualize my kids as teenagers that don't want to snuggle with me anymore. And then there I am, present in the moment, enjoying every moment of, snuggling with them, doing bedtime. Sometimes there are pains in the butt about bedtime, right? And it takes forever, right? I've got stuff I need to do. I've got a podcast. I've got my practice. We've started a podcast network for doctors. I've got a lot on my plate. And so I really need to get to my work, but I don't know how many cuddles I've got left. I don't know how many snuggles I got. They're going to be some stinky teenagers soon where it's not going to be, that's not going to happen anymore. So when it does happen, I use something called negative visualization, right? Imagine my life without it, not in a dark way, right? Not like the kids being, gone, but just being older where it's not something that happens. And it helps me be more present and be in the moment. When I was pulling them around the backyard in the sled, I had to set ground rules, which really took no cursing and no slowing your brother down. You weren't allowed, because man, it was so much easier last year when they were lighter and I was younger, but it's gotten so much harder to pull them around on that sled. So you can't get in your brother's way. It slows it down because I just don't have much energy left in me. It took all the fun out of it. And then I thought for a moment and I'm like, come on, Brad, just stop being so negative about it. Let them have fun. You have fun with them because, next year they're going to be bigger and heavier and it just might not be fun for them anymore. So enjoy it while you can. And so that's, so one, just recognize the fluidity of what's important and how it can change from month to month and year to year and will change. And so you set priorities on a fluid basis. And two is that negative visualization so that you do savor everything that you can to be as present as you can with them.
Yeah, it's a balancing life. It's not a balanced life. It's always a balancing life. And you give and take, and you got your setup in your house. You've decreased the commute, so it's there when you need it on the weekend. You just go super hard on the weekend, and on the weekdays you focus on your kids. That's awesome.
Right.
And then making sure that the negative visualizing down the line when you don't have it, so you can cherish what you have now and being grateful for it now. So that is awesome advice. And like you said, my son, sometimes he wants to read and more books and more books and more books. And then now he's in the stage of more hugs, more hugs, more hugs. I'm like, oh, okay.
Yeah.
Fine. More
Yeah.
hugs. And then we
Yeah.
just keep hugging.
You're like, I have all this stuff on my to-do list, and it's hard I can't say that I never do that. I do that. I do it a lot. I do it a lot. But the thing, where I'm like, oh God, I gotta get to my to-do list. These are all these things I need to do. But, you'll find too, as your kids get a little older, they get more self-sufficient. And when they get more self-sufficient, that frees up a lot more time, and then they're going to get a little older. They're going to start entertaining each other and playing with each other. And that gives you even more time. And so it's, it ends up getting easier. And then sports start, and then you'll have even less time.
It's all cycles. It's all,
Exactly.
yeah. Just going with it's a fluid life, essentially, right?
Exactly.
So I know we talked about a lot. So for our audience, if they were to take one action or two, what would it be after this?
So I guess for the doctors is really, since we covered most in the exam room, I think, the one easy takeaway that I think will benefit the patient and the doctor would be find something to connect with the patient with that has nothing to do with why they're there, right? Find something on their person or about them that you can ask them about that'll help you connect better with them, because it'll help you enjoy those connections. Are what, that's what I think the meaning of life is, really connection, right? What are we finding? We're finding that one of the best predictors of health and longevity, if not the best predictor, is the strength of your social connections. And so that's not a social connection. It's not your social life, right? It's your professional life. These are not your friends, they're your patients. But still, these little connections go a long way for you and for them, to you enjoying the visit and for them appreciating you. So I think if you're going to do one thing, and to your point, it's not just for the doctors. It's in lots of professions, right? You're someone's accountant. You're a salesperson. Notice something about them that you can ask them about that helps you see them for more than just what they came to see you about.
Awesome. Thank you so much for coming on to the show. And thank you again to the audience for, your presence, your attention. Of course, everything that we talk about is going to be in the show notes, productivitymd.com. And where can they find you? Either social media, your website?
So Physician's Guide to Doctoring.com. I'm on the socials at Physician's Guide, on Threads, on Instagram, on Blue Sky, on LinkedIn is Bradley B. Block, MD. And, the podcast is Physician's Guide to Doctoring. You can find it on Apple and Spotify and Overcast, are apparently the three most popular that people find me, on YouTube as well. And then if you're a physician and you're thinking about starting a podcast, or you have a podcast, join our network, Doctor Podcast Network. So go to drpodcast.co. Sorry, drpodcastnetwork.co.
There we go. Doctor Podcast Network.co. And then everybody, please go to follow your podcast, okay?
Yes.
As well. So please subscribe, go follow if you want more tips on communication or anything that has to do with, patients, doctoring, etc. So again, thank you so much, Brad, for coming onto the show. I learned a lot for my own ER shifts coming up. I will test it out and I will let you know how it goes.
Please, thank you so much for having me.
Yeah, of course.
And Brad,
it has. It's been I learned these are all very practical. And I think what you teach, will have the ripple effect. If one physician can impact a lot of patients, increase self-efficacy, then perhaps, there's a ripple effect of the health span, increasing their health span. I wonder. So thank you again. And just remember, to the audience, everything that we need is within us now. Thank you.
Disclaimer: this content is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed. The use of this information linked to this content is at the user's own risk. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical conditions they may have, and should seek the assistance of their healthcare professionals for any such conditions. The views are personal views only and do not represent any university or government institution.